Good morning. I'd like to thank everybody for being here today. I've been wearing my mask during all of our prior press conferences and realized that I'm 20 feet or 25 feet from the nearest person. So today I will be doing this without my mask. However, if there was anybody within 6 or 10 feet of me, I would be wearing a mask right now. Even though I am double vaccinated, it's still critically important that everybody wears their masks. I have some good news today and some bad news. Let me say that I've been saying, and if you are the same people that have been watching in the past, you've heard me say for at least 6 weeks now that I expected that by sometime in April, we would reach a 50% adult vaccination rate in Broward County. Well, the answer is that we have reached today a 50% vaccination rate, adult vaccination rate in Broward County. The adult population of Broward County is approximately 1.55 million. 50% of that is 775,000. As of yesterday, we were 772,000, and we are going at around 7,000. We vaccinated around 7,000 people yesterday, so sometime today we will have gone above the 50% adult vaccination rate in Broward County. And I'd been saying that that was going to happen in April, and it has. The other thing that I said would occur in April is that we would reach a point where we would have more vaccine than people that wanted it. And the bad news is that has also occurred. We had been vaccinating around 20 to 25,000 people a day. It seems that we have vaccinated most people in Broward that were eager to get the vaccine, and in fact, most people in Broward that have wanted to get the vaccine. Now, that doesn't mean we have vaccinated everybody in Broward that is willing to get the vaccine, and that's something that we will need to work on, but the numbers are clearly declining. As a matter of fact, the Broward County, the state of Florida Department of Health in Broward County vaccination sites are now saying that you can show up without any appointment because the demand has slowed down enough. And in fact, if you are 17 or 18 years old, you can get the Pfizer vaccine at those sites. We need to increase that number. The county commission, those of you that saw our last two meetings, has voted to reopen, pass a reopening plan for Broward County. The meeting on April 6th, we voted to reopen the county, and we voted to immediately reopen all outdoors activities. That order was signed earlier this week. And so all of the outdoors activities are now reopened. Our Broward County parks, you no longer need to wear masks. If you're golfing, you don't need to wear masks. If you're golfing, you can now touch the pin and the rakes, if the pools, etc. The only time that you are still required to wear a mask outdoors is if you are on a line. So, for example, if you're waiting online at a bar, or if you're at a concert where people are shoulder to shoulder, you still need to wear a mask in those circumstances. But if you're walking in a park or you're walking down the street, again, masks are no longer required, although they are certainly, even if you're walking on the street, if it's crowded, they are encouraged. Our original plan was a well thought out plan. I had spoken with Dr. Anthony Fauci, with the CDC, with the United States Department of Health and Human Services, with the state epidemiologist of the state of Florida, with the North and South Broward Hospital Districts, with Dr. Paula Thacci, who is the director of the Florida Department of Health in Broward County. And that was a two-part plan. It said, in addition to immediately opening the outdoors, that we would lift most of the remaining capacity restrictions and distance dining for dining, hotel, etc. restrictions. When we reached 50% adult vaccination rate for at least one shot, which we have reached today. So that's the first part. And the second part was that you would have to, Broward County would have to be below 5% positivity rating for at least 10 consecutive days. Now, I'm hoping that we will get to that number fairly soon. Some people have questioned whether that is still a legitimate number because they've said that people that have already been vaccinated aren't going to take the test, so you're only testing unvaccinated people. The CDC and Johns Hopkins disagree with that, but I am trying to work with the business community and with the rest of the Broward County Commission. There are 3 commissioners out of the 9 of us that have been pushing for a more rapid reopening. And so what we have done is, forgot one thing. So what we have done is, at our last meeting, amend that order to say that you have to be, Broward County, you have to be 50% vaccinated adult, one shot at least, which we've reached that milestone today, and either a 5% vaccination rate, and we lowered that for 10 consecutive days to 7 consecutive days, or use the Johns Hopkins method of measuring. That method would say it only measures the new positive test rates. They have recommended a rate of 10 per 100,000 new positivity before you can reopen. Trying to meet in the middle with the commissioners that wanted a quicker reopening, we have changed that and we are going with a 15 per 100,000. Again, that's only new cases, so you can only count once under that scenario, and that eliminates any potential bias of the positivity rating only being tested among unvaccinated people. Now, CDC and Johns Hopkins have recommended that we use both, that the new cases be below 10%, be below 10 per 100,000, and we be below 5%. Trying to work with the 3 commissioners who want a faster reopening and the business community that wants a faster reopening, we're saying we will do either the 50% adult vaccination, which we've already reached, and either below 5% for 7 consecutive days, or below 10 new cases per 100,000 for 7 consecutive days. Our gating numbers are going up, or have been going up, and that seems counterintuitive because as vaccinations increase, the number of people getting COVID should be decreasing. That hasn't been the case recently. Both the vaccinations have been going up and the number of people getting sick have been going up, and that's because some people have just abandoned any pretense of wearing masks when they're indoors, of just social distancing and being careful. Additional, the variants are a major problem. Florida has been the highest state in the nation, although Michigan may have passed us recently, but we have been the highest state in the nation, and Broward County has been the highest county in the state for the variants. In the last 5 days or so, the numbers have just started to bend. But if you look at the gating criteria from April 21st through March 1st, and that's just the last couple of weeks, as of March 11th, so this is 6 weeks old, the percentage of hospital emergency department visits with influenza-like illness was 14.8%. The most recent one was 22.6%. That's a lagging indicator going to the hospital. Number of hospital emergency departments with influenza-like illness as chief complaint in March was 377. Today it's 655. The number of hospital COVID census per day in March 11th was 510. Today it's 548. The number of COVID hospital admissions per day 6 weeks ago was 73. Today it's 84. The hospital inpatient bed occupancy 6 weeks ago was 82.9%. Today it's 84.2. Again, these are all lagging indicators, however. So we have seen just in the last 5 days the curve starting to bend. Until we have the curve bent, until we're below 5%, I'm asking everybody that's indoors, anywhere close to people, follow the rules, wear your masks. The critical issue right now is getting everybody vaccinated. On Wednesday, I joined Miami-Dade County Mayor Daniela Levine Cava and other groups at Florida Memorial University to demonstrate the importance to Broward County. The majority of the Broward County Commission was in attendance. Myself, the Vice Mayor, and 3 additional commissioners were in attendance, as well as our Deputy County Administrator. We're working on a plan called I Did It, or in Spanish, lo hice, to say, I did it, I got the vaccination. And it's showing not politicians, it's showing people, it's showing doctors and nurses and people work in transportation and waiters and everybody else. It's showing people saying, I did it, I got my vaccination. We're urging everybody else to do so. The I Did It campaign will be on TV and social media. It's going out in 4 languages, English, Spanish, Creole, and Portuguese, because of the Brazilian community here. It is absolutely critical that we get this done, that we get everybody vaccinated. In order to get this done, we need everybody. And we've been saying that we needed, I've been saying that I thought that the county would get to 65% vaccination. I still think we will, but that's not really enough, as I'll say in a minute. We're only at 50%, and our vaccination rates have slowed. They're now only about a third of what they were a few weeks ago, because we've vaccinated most people that want it. So now we have to shift towards turning out people to get vaccinated. This is going to require everybody to help. County commissioners in Broward represent somewhere between 220, 240, 220,000, 240,000 people. Our municipal officials, particularly in single-member districts, may be representing 5 or 10,000 people. Some, of course, are larger, 15 or 20 if they're in a single-member district. But that's a manageable number. Our municipal elected officials know better than the county elected officials. We need our faith-based and our community leaders in every community in Broward. There's a slow uptake in the Black community. We need our faith-based and community leaders, but we have to understand that the Black community is not monolithic. We need the faith-based and community leaders in the English-speaking Caribbean community, in the French-speaking Caribbean community, in the African-American community. We need to understand in the Hispanic community, it's the same thing. You cannot treat, we should know this, we cannot do the same message for the Cuban community, the Puerto Rican community, the Venezuelan community, and all of the other Hispanic communities that make up the rich mosaic of Broward County. We need faith-based and community leaders in all of these different communities. Republican in general and Republican men in particular have been slow on willing to get vaccination. We need our Republican community leaders and elected officials to make an example and show them getting vaccinated. It doesn't matter what your political party is. It doesn't matter what your ethnicity is. It doesn't matter what your religion is. You need to get vaccinated. And I said, we have to bend the curve. We're only at 50% now. I've been hoping that we would get to 65%. I'm not sure we're going to get there. 65% isn't enough. We've been told that in order to reach herd immunity, we need 70 to 80% vaccination rate. Now, it's unclear to what extent people that have had COVID will contribute to that 70 or 80%. Because if you have received a mild case of COVID, you may have very mild antibodies. Science just doesn't know that. And we've been trying to follow the science. What they have told us is we need to get to 70 to 80%. We need to get there, and we need your help. We need the community leaders' help. We need the news media's help. We need to get out the message. Everybody needs to get the vaccine. You need to do it to protect yourself. You need to do it to protect your family. You need to do it to protect your friends. You need to do it to protect your community. You need to get vaccinated so that we can reopen our businesses 100%. Everybody needs to get vaccinated. There is no excuse. It is free. Please get vaccinated. That is what we need to do now. We need to do it before the variants take hold. We've been getting warnings from the CDC, from Dr. Fauci, from HHS, from everybody. The longer the vaccine is out there spreading, the more likely it is that new vaccines will emerge that can be resistant to the vaccine. Thus far, the vaccine seems to be effective against every variant. So please, get vaccinated and do it immediately. One other issue that I wanted to bring up is the rent assistance program in Broward County. I've been asked about this in the past. It went active this morning. The phone assistance program will be activated at noon today. The website has already been activated. If people are looking for rental assistance in Broward County, they can go online at broward.org/rent assistance. Okay, I was told I had to do that slowly. So that concludes my remarks today. I'll be happy to take any questions. We're really getting close to where we need to be. We're over the 50% vaccination threshold. We are slowing down vaccinations for the first time, not because we don't have enough vaccine. We have the vaccine. We don't have enough people that want it. Please protect everybody you care about, yourself, your community. Get vaccinated. And I'm happy to answer any questions then, if there are any. Yes, ma'am.
Mayor, how are you?
Okay,
I have a couple of questions.
take your time.
So,
Just ask them one at a time, please.
Okay.
Because I'm not going to remember them otherwise.
okay, let's begin with Broward Health stopping
Yes,
today.
Yes.
I listened to your roundtable this morning. So they said today will be the last day.
yes,
You may have heard this, and I can attest to it because it's happened to me. For weeks, I tried to get an appointment at Broward Health, and I couldn't. And
Okay.
a lot of my neighbors, same thing. And so then to wake up and say, we're not doing any first time anymore, I don't know whether that's a product of how they did their computer system but a lot of people are very disappointed about now that's one less option. And secondly, what happens when they lower the age? There are many people counting on their 14-year-olds and 15-year-olds later this summer. So if you have one less entity, have you heard this same problem that by pulling out or not offering first, it's one less available spot to get a vaccine?
I have not heard complaints about that, but I wouldn't have because today is their last day. So I think a lot of people don't even know that they have stopped yet. What Broward Health has said, we pulled them into service, and it's been costing them a lot of money. We pulled them into service when the lines were unreasonably long at the Florida Department of Health sites at Broward County parks. We are actually expanding the hours at the Broward County parks so that there are no lines. There really are no lines right now because as little as 2 or 3 weeks ago when we were doing 20 to 25,000 a day, today we're at a third of that. There should be no lines to speak of. I mean, short lines at any of the county parks. If it becomes an issue, I will ask Broward Health to reopen at least one of their sites. But thus far, we'll have to see if it's an issue. In reference to the people under 16, that's a question that the national CDC, HHS, and others are looking at when they will be eligible, because again, children are not just smaller adults. They need to check. They're talking about trying to get particularly the Pfizer vaccine approved, and I'm expecting it will be approved shortly, but just adding 15 and 16-year-olds, that's a fairly small cohort, and I'm not expecting that will cause the lines. I will tell you that as part of the I Did It or Loise campaign, that you will see the county is trying, and the Florida Department of Health is trying not only to have the parks, but we still have, I believe, Walgreens, and I believe Publix is still doing it. I can't swear to that. But we are trying to actually set up mobile sites, going to people, go to perhaps malls or wherever people congregate. We're going to large employers. We're trying to do everything that we can to get out to the community because it is critical that we keep our vaccination rate up.
Okay, secondly, I think you have touched on it, but I'm sure you're aware there are a number of healthcare workers who do not want to take the vaccine.
I am.
Including many in South Florida.
I am.
And also we understand anecdotally there are even some religious organizations discouraging members. This is happening in South Florida, so what do you say to that, and how much further will that take you to being able to declare the county open?
Well, the county will open when we are either below 5% for 7 consecutive days, or when the new cases fall below 15 new cases per 100,000 for 7 consecutive days. Today, our number is, I think, either 5.7 or 5.8%. So we're not that far away. For those healthcare workers, I think you'll find that the majority of the physicians have been vaccinated. The majority of the registered nurses have been vaccinated. I think there are a lot of people that are working in the hospitals that have chosen not to get vaccinated, and they should have been able to see the effect from all of the people that have been hospitalized, from all of the people that have been put on ventilators, from all of the people that have died from COVID, that they should get vaccinated. Even the Johnson & Johnson vaccine, which seems to be the riskiest, and I'm not a physician or scientist, so I can't comment on that, but the number of blood clots that were diagnosed were less than 1 per million, and the chances of contracting COVID are a lot higher than that. So I would urge people, everybody, to get vaccinated. For those people that have religious objections, most religions believe that the most important issue is the preservation of life. If you are a Christian Scientist who don't believe in in this. I'm not going to touch on vaccinations, I should say. I'm not going to touch on this. Obviously, we are not going to require any people to get vaccinated, but with sincere religious objections. But I will say that everybody should get vaccinated. And I've seen, particularly in nursing homes, that there's a large number of people working in nursing homes that have not been vaccinated. We need, a lot of those are people that were not born in this country, and we need desperately community leaders from representing all of our immigrant communities, all of our different ethnic groups. We need leaders from every group to urge people in their communities to get vaccinated to protect themselves and the other members of their community and the community at large and their friends and family.
Okay, thank you.
Yes, next question. Are there any additional questions? By the way, I'll be doing some remarks in Spanish after I'm done, if anybody wants. I'm not wearing my glasses, so I see a blue blob back there.
Hi, Mr. Mayor. I have been asked to ask you about your thoughts concerning the current situation at the Broward School Board.
Okay. I assume you're talking about the fact that Superintendent Runcie was suspended along with the attorney?
Yes.
Okay.
Yeah, there was a demonstration or a gathering this morning for support, and just if you have thoughts on the situation, that's it.
Okay. I would not have attended the demonstration in support, nor would I have criticized Mr. Runcie, because at this point in time, what I have seen is completely lacking in any information, stating that he made statements that were perjurious, that were not accurate, doesn't tell me what he actually said or the truth or not. If he said something like, I believe students were well protected, and a grand jury decided, well, we don't think they were, so we're indicting him, that would be ridiculous. If he said something at 2:00 in the afternoon, I was attending a meeting, and in fact, in Broward County, and in fact, he was on vacation in the Bahamas, that's probably not what actually occurred. But I mean, if there was a clear factual violation, if he lied in an official proceeding, that's perjury. If a statement of his was interpreted differently than he intended, that's not perjury. I know that there are a lot of people that will make blanket statements without knowing the facts. I, however, am not one of those people. Until I know the facts, I can make no statements other than what I've said, which is I'm waiting to see the facts. Are there any additional questions? Yes,
Hi, Mayor.
ma'am.
Christina Vasquez, Local 10 News. Earlier this week, I interviewed Claire Hannon. She's the executive director for the Association of Immunization Managers. And she said, looking nationally, one group that seems to be particularly hesitant to the vaccine are conservative white evangelicals. In the same interview, she said some of the progress being made with vaccinations happening, again, nationwide within Black communities was bringing those stakeholders to the actual table. So she really credited outreach efforts that were targeted with pastors, Black church leaders, and kind of indicating perhaps we should be doing something similar to other groups that we are now seeing to be hesitant. Wondering whether or not there's a strategy in development, maybe from whether it's with the commissioners or maybe it's the mayors within the different cities working in unison with the medical infectious disease experts that have been counseling you all to really go out and bring in white conservative evangelical church leaders into conversations for education, to really listen to their concerns and to kind of work with them in the same way we've seen that sort of person-to-person targeted outreach benefit vaccination rates in the Black community.
Very good question. First, let me address the Black community, then I will go into the evangelical community. That's exactly what the I Did It campaign is working on. We have done outreach, as you heard me say, to faith-based leaders. We have done outreach to community leaders. And in the Black community, again, you have to treat separate segments of the Black community differently. Somebody who's Haitian may not listen to the same people as a Haitian American may not listen to the same people as an African American. So we have reached out to the different leadership, including but not limited to faith-based communities in the Black and Hispanic communities. In terms of, and again, not an area I'm an expert in, evangelical Republican community, I'm a Jewish Democrat. But in the mayor's call today, I know there are a number of mayors that are elected Republicans, and I specifically asked them to be reaching out to other Republicans because they can do it a lot more easily than I can. I mean, realistically, it would be difficult. I'm not the best person to reach out to the African American community or the Jamaican community or the Haitian community or the evangelical Republican community. You're correct. We need people. I am not sure whether it's because they're evangelical or because they're Republican. There's a very large overlap between the two. I would hope that President Trump would help the country and just publicly come out and start aggressively asking people to get vaccinated. I've seen studies that said that if he said that would get a lot of people to do it. I would hope that Governor DeSantis, I would hope that Senator Scott, I would hope that Senator Rubio would be more active in urging Republicans to get vaccinated. The legislature is in its last, you have today, then 1 week from today it adjourns. I would hope that the legislative leadership would send out the message, it's important to get vaccinated. But you're right, that message needs to come from either evangelical leaders or Republican leaders. Again, a lot of overlap there. And they need to be the ones to do it. And just like I can't tell you, how to get that message out into other minority communities, I personally don't know how to get that message out into the Republican community. But I have been saying every speech I've been giving that we have to make sure that regardless of race, ethnicity, national origin, or political party, or religion, that everybody get vaccinated, because for the evangelicals who are always saying, choose life, one of the biblical commandments, that life is important, you must protect life. The way to do that is getting the shot in the arm. I'm hoping the evangelical community will understand that, but that will rely on evangelical leaders.
Thank you.
Of course. Are there any other questions? Anybody know any good jokes? Okay. I honestly can't see you back there. I see a white blob. There's, I think, a blonde blob, but I can't even really count the blobs. I think it's 4 or 5. If there are any other questions, please ask them now. Otherwise, I'll end this and then in about a minute or two give remarks in Spanish. Anything else? If not, thank you for being here. But